It is an uncomfortable question some breast cancer patients wrestle with. Did I do something to get cancer? So this evening, I'm joined by Dr. Sandrine Crane, a hematologist oncologist at Novant Health Cancer Institute here in Greensboro. So, doctor, a lot of patients do sometimes wrestle with that thought. Did I cause something, to happen to me? How would you explain that idea with someone grappling with that thought?
Thank you for having me. So when I'm faced with that question, I first of all reassure my patients. I share with them the fact that we know that cancer is caused by multiple risk factors, and it's rare that one element is the only cause of breast cancer. For example, known risk factors for breast cancer includes being a woman, being older. So it is a cancer that's more common as we get older. Sometimes having dense breast tissue. Having started menstruation early, genetic factors, family history, and there are also lifestyle choices that sometimes can contribute to breast cancer, including smoking cigarettes, alcohol misuse, sometimes using estrogen-based medication, either before menopause as birth control pills or in post-menopause as hormonal replacement.
All right, so kind of let's break down some of those things. When you talk about the lifestyle choices and you're talking about alcohol or smoking, to what degree can stopping those really affect breast cancer?
We don't have strong data that tells us how much smoking cessation or stopping alcohol misuse can influence the risk of breast cancer recurrence or even getting breast cancer in the first place. But we know the way both tobacco use and alcohol contributes to breast cancer, and we know that increasing inflammation in the body, causing genetic changes or errors in the body that can contribute to cancer, and we know that changing those risk factors can help decrease risk of breast cancer.
All right. So let's say someone has already been diagnosed with breast cancer. Is there an added benefit in changing the lifestyle habits post-diagnosis, or is it too late?
It's never too late. So there are very many beneficial benefits of smoking cessation and alcohol cessation. We know that specifically for breast cancer, quitting alcohol can decrease the risk of recurrence by close to 30%. We do not have the same data for alcohol, for tobacco use, but it is encouraged because it can promote a happy lifestyle in general.
Okay, let's then now talk about birth control pills, hormone replacement therapy. How do doctors assess when the benefits outweigh the risks?
It is a good question, and very often we do have to have a risk and benefit conversation with the patient. We know that, especially in postmenopausal, which is when most of the breast cancer tends to occur, patients are struggling with menopausal symptoms, either hot flashes, changes in mood, loss of bone density, and there are other medications that can be used to actually treat those side effects of menopause that do not require estrogen use. And for patients who do not respond to any other intervention, we do recommend to use the minimal amount of estrogen and to use it for the least amount of time that's necessary.
Okay, now let's talk about genetics, because sometimes you just have genetics and that's what links you to your breast cancer. Can you talk about genetics and also what random errors in cells, what does that mean and what kind of role does that play?
Yes, so the way we understand how cancer cells are promoted, all our cells every few seconds actually have to replicate our DNA to make new cells and keep us going. And every once in a while, the body makes a mistake, and that's what we call a mutation. And one of those mistakes can be persistent and eventually lead to a cancer. There are people who do have predisposition, they have genetic changes or mutations that they were born with, and those do represent about 5 to 10% cases of breast cancer. And we usually promote people having genetic testing when it's indicated, so other family members can also be included and take precautions, having mammogram, MRI on time, and being proactive in terms of screening.
Okay, we have just a short time, maybe 30 seconds or so. What do you want to leave patients with who are wrestling with that guilt of, did I cause this?
I want to reassure patients that a diagnosis of breast cancer can be devastating, and I want to make sure patients don't go home thinking like they are the reason why they have this condition. And it's never one element that causes breast cancer or any type of cancer. And we are going to be there through their journey of breast cancer diagnosis and treatment.
Yeah, we probably just need to focus on the fight by that point in time if that diagnosis has happened. Thank you so much for your time and your expertise. And maybe you need to send this interview to someone. This is going to be in the Who Wants to Know section of our website.